A client has been on the nursing unit for 2 hours following a retropubic prostatectomy for the treatment of prostate cancer. The client is receiving a continuous bladder irrigation of normal saline infusing at 1,000 milliliters per hour. The client's urine output for the past 2 hours is 410 milliliters. What is the nurse's first action? Answer 4. Stop the irrigation flow. The catheter output should be at least the volume of irrigation input plus the client's actual urine. A severe decrease in output indicates obstruction in the drainage system. The first action is to stop the irrigation flow to prevent further bladder distension. Bladder distension is one of the main causes of hemorrhage in the fresh post-op period. A client with a history of alcoholism arrives at the clinic reporting severe abdominal pain with nausea and vomiting. What additional findings would make the nurse suspect the client may have pancreatitis? Correct answer to N4, 2. Cullen sign, 5. Tachycardia. Whether the client is experiencing acute or chronic pancreatitis, symptoms are severe and distinct. Bruising around the umbilicus is referred to as Cullen sign, indicating internal bleeding. Because of inflammation in the pancreas, the client generally becomes febrile and has pain, both causing tachycardia. A primipara at 36 weeks gestation is seen in the OB/GYN clinic. Which symptom should the nurse immediately report to the primary healthcare provider? Answer 1. Puffy hands and face. 1. Correct. Facial and upper extremity edema can be a sign of preeclampsia, which can endanger both the mother and fetus. Preeclampsia is a pregnancy complication characterized by high blood pressure and signs of damage to another organ system, often the kidneys. Preeclampsia usually begins after 20 weeks of pregnancy in a woman whose blood pressure had been normal. Even a slight rise in blood pressure may be a sign of preeclampsia. Left untreated, preeclampsia can lead to serious, even fatal, complications. Signs and symptoms of preeclampsia include hypertension and may include proteinuria, severe headaches, changes in vision, upper abdominal pain, nausea or vomiting, decreased urine output, thrombocytopenia, impaired liver function, shortness of breath, sudden weight gain, and edema, particularly in face and hands. A client arrives at the emergency room with active gastrointestinal bleeding. What is the most important nursing action? Answer 3. Initiate an intravenous access line. 3. Correct. The client has active gastrointestinal bleeding, which can quickly lead to hypovolemic shock. Active bleeding would be treated with fluids, and in certain cases, blood products. Establishing an site allows for immediate initiation of treatment before veins vasoconstrict and become too difficult to access secondary to shock. A client is scheduled to have a cardiac positron emission tomography PET. What pre-procedure information should the nurse provide to the client? Answer 1 to 351. Avoid caffeinated food and drinks for 24 hours prior to test. 2. Do not eat for 4 to 6 hours before the test. 3. Do not wear jewelry. 5. Wear comfortable, loose-fitting clothing. 1, 2, 3, and 5 correct. The client should avoid products containing caffeine for 24 hours prior to the stress test. Caffeine increases the heart rate and can affect the results of the test. Don't eat or drink anything except water for 4 hours before the test. The fullness from a meal makes it difficult to perform the stress test. Any jewelry or metal will show up on the scan and cause a false result. Prior to removal of cataracts, the client is to receive eye drops in both eyes. The nurse knows what action takes priority. 1. Remove any exudate around eyes with warm water. 2. Instill exact number of drops into lower conjunctival sac. 3. Instruct client to look upward when drops are instilled. 4. Avoid dropping the medication directly on the cornea. 4. Correct. The most important safety consideration when instilling eye drops is to avoid dropping the medication directly onto the cornea. The extreme sensitivity of the cornea before and after eye surgery could cause serious eye problems if meds were dropped onto the cornea. The nurse assesses a client post-thyroidectomy for complications by performing which assessment? 1. Accu-Check. 2. Vostex. 3. Ballottement. 4. Ice water colonic. 2. Correct. A positive Vostex and Trousseau's is indicative of tetany and low calcium. This can occur when a couple of parathyroids are accidentally removed. When the thyroid is removed, the parents of a child hospitalized with cystic fibrosis have been given discharge instructions. The nurse knows that teaching has been successful when the parents make what statement? 1. Our child will need to have a gluten-free diet. 2. The enzymes should be given at bedtime daily. 3. Salt needs to be decreased in our child's diet. 4. We need to prepare high-calorie, high-fat meals. 4. Correct. Cystic fibrosis is an inherited disorder in which abnormally viscous secretions affect the respiratory and digestive systems. Because the client is unable to absorb nutrients, several dietary adaptations are crucial, including frequent small meals along with digestive enzymes to help the client process food. The meals should be high-calorie, high-fat with increased amounts of sodium to help stabilize fluids. While preparing and for in the medroom, you observe a new nurse drawing up a dose of insulin in a tuberculin syringe. What is your priority action? 1. Report the incident immediately to the charge nurse. 2. Tell new nurse you will prepare and give the insulin dose. 3. Discuss procedure to prepare insulin with the new nurse. 4. Draw up insulin, but let new nurse administer the injection. 3. Correct. This situation is dangerous since the new nurse obviously does not know the proper process or even the correct syringe with which to draw up insulin. This lack of knowledge could lead to serious or even fatal consequences for a client. It is vital the new nurse be properly instructed and then supervised on how to prepare insulin. Additional measures to ensure client safety can then be pursued. Following a motor vehicle accident, a client is brought to the emergency room with shallow, labored respirations. The client is intubated and placed on a ventilator. What is the nurse's priority action immediately after the intubation? 1. Suction to clear all secretions. 2. Listen for bilateral breath sounds. 3. Secure the endotracheal tube. 4. Obtain X-ray to verify tube placement. 2. Correct. All actions are important, but assessment is the nurse's immediate priority. Clear and equal bilateral breath sounds along with equal chest wall movement would confirm that the endotracheal tube has been correctly inserted into trachea. The nurse is discharging the client after removing sutures from an abdominal wound. Which instructions should the nurse give the client at the time of discharge to reduce the risk of complications? 1. Inspect the wound daily for any changes. 2. Resume normal activities when you go home. 3. Keep the incision covered at all times. 4. Follow up with primary healthcare provider when scheduled. 1. Correct. The wound should be inspected daily for any signs of infection once the client goes home. Healing has only just begun by discharge. Signs of wound infection include increased pain, swelling, redness, or warmth around the affected area. Red streaks extending from the affected area, drainage of pus from the area, fever. The nurse is caring for a client following a transurethral resection of the prostate TURP. The client has a 3-way irrigation catheter in place. Which finding would indicate the need to increase the irrigation rate? 1. Clots in urine. 2. Unable to palpate bladder. 3. Slightly pink tinged urine. 4. No report of bladder spasms. 1. Correct. The irrigation should be increased if you see clots in order to keep the catheter patent. A 90-year-old male is visited by a community nurse in their home. The client asks how they can protect themselves from getting sick. Which of the following health promotion activities is most effective in pneumonia prevention? 1. Obtaining the influenza vaccine annually. 2. Obtaining a first dose of the pneumococcal pneumonia vaccine. 3. Maintaining a physically active lifestyle. 4. Ensuring adequate fluid intake. Correct answer 1. Obtaining immunization annually against influenza. is the most effective preventive measure for pneumonia, obtaining an annual influenza immunization and a pneumococcal pneumonia vaccination are effective preventive measures for pneumonia. A client has catecholamine laboratory testing completed for their blood and urine. What is measured in this type of laboratory test? Select all that apply. 1. Dopamine levels. 2. Acetylcholine levels. 3. Norepinephrine levels. 4. Epinephrine levels. 5. Serotonin levels. Correct answers 1, 3, 4. Dopamine, norepinephrine, and epinephrine levels are measured in a catecholamine test. This test can encompass both blood and urine. It will also measure values while the client is sitting and standing during blood collection. A client with a recent stroke is experiencing blindness in part of the visual field of both eyes. Which spatial perceptual deficit related to stroke are they experiencing? 1. Agnosia. 2. Unilateral neglect. 3. Homonymous hemianopsia. 4. Apraxia. Correct answers. 3. Homonymous hemianopsia is blindness in part of the visual field of both eyes and makes it difficult for clients to judge distances.